Dr. Ann, can you tell us a little bit about the connection between mother and child?
So there's kind of a biological answer to that, and then also an environmental answer. Biologically, the mother and the child are connected through the placenta, and so the mother's blood flows through the placenta, and then there's some filtering system, but then most of what is in the mother's blood goes on to the baby, to the fetus. So there's a very direct connection, and everything from the mother's oxygen level to any toxins that she might be breathing in that would go into her bloodstream are going to directly affect the fetus. Her nutrition, how much protein she eats, things like if she has diabetes and her blood sugar level is elevated, all of those things in ways that are some more straightforward and some more complex will directly affect the fetus. I would add as a neonatologist that when we take care of our newborn patients, whether they're born at term or whether they're born prematurely, the most important history that we gather of our patients is related to their mother's history during pregnancy. And that's how we can begin to understand how we would expect those patients to do and what their risks are.
Can you talk a little bit about when you're delivering child in the NICU? What are the? I understand that you're seeing babies that are most vulnerable. They've gone through the most trauma. Why are they there? Why does this happen? What is it about this experience that would lead to the child being preterm and ending up in your ER?
So we have babies in our Neonatal Intensive Care Unit for many reasons. One of them is prematurity, but just to clarify, there are lots and lots of other reasons that babies end up in an intensive care unit. Why babies are born prematurely actually is something that we still don't understand very well. There are some cases in which babies are born prematurely because the mother has a condition that's very dangerous for her health, and so the baby needs to be delivered for the health of the mother. There's also conditions in which the mother goes into spontaneous preterm labor, and we don't always understand the biology of that. So it's something that both obstetricians and pediatricians have been extremely interested in over the decades that have been the most recent decades. But actually we still don't have a satisfactory understanding.